Health and Family Welfare Minister James Sangma today inaugurated a 500 litre per minute oxygen generation plant at Dr. H. Gordon Roberts Hospital at Jayao, Shillong, in the presence of Principal Secretary Sampath Kumar. In his address, the Health Minister said that although the state is returning to normalcy and COVID-19 cases have significantly reduced, the oxygen plant will continue to assist the hospital in the future. He added that the government has set an ambitious target to reduce infant and maternal mortality rate to zero. He also said that the government aims at scaling the public-private partnership model in the healthcare sector so the public can collaborate with the government to assist in tackling challenges in healthcare.
Today, we see a return to normalcy, as was mentioned by Dr. Nomrum, that from the 5th of March till date, there have been nil cases, at least in this hospital. We are seeing a return to normalcy, and this is really so encouraging for all of us, and we thank Almighty God that finally we are seeing a return to normalcy. And this oxygen plant that we have inaugurated was specifically for COVID, to provide that kind of support during COVID for oxygen, which was so crucial at that juncture. But when we see a return to normalcy, I'm extremely confident and optimistic that this oxygen plant will continue to provide that kind of support and service for the challenges that lie ahead now that we move away from COVID. Two of the challenges which you mentioned were regarding the infant mortality rate and the maternal mortality rate. These are extremely high in our state, higher than the national average, and the focus is on bringing it down. But we are setting a very ambitious target for ourselves, and that target is not just to reduce maternal and infant mortality rate to a controllable number which is below the national average. No, our goal, although it's a very ambitious goal, is to bring it down to zero. That means zero maternal mortality and zero infant mortality. That is, I know, extremely challenging because we are still struggling with so much of infrastructural needs. But I think that if we collaborate with all stakeholders, with community, I think that is something we will be able to achieve within a very short span of time.
Principal Secretary Sampath Kumar said that strengthening mission-run hospitals and private hospitals in the state will improve healthcare sector in the state.
So here we require to really change that approach. Maybe here actually I would like to request the Robert Hospital whether you can take up certain pockets, certain districts, that we would work not only on the hospital care but also on the primary care. How actually we can work with village health councils. A new concept has come up. So this is again our state cabinet has approved the village health council concept, which is first of its kind in the world, where the communities are going to be given elected bodies like Darbar Shnongs. The elected bodies would be given the responsibility to participate in the healthcare. Healthcare is, as Marbani said, healthcare should not be a sick care. Only when you get sick, you come to the health. Healthcare should be healthcare. Healthcare is, you should have predictive care. You should know that, when I give an example. When we know that there is a lot of women die of cervical cancer, we request that if Gordon Brown Hospital and also the church, I would like to, because it's again the church has a very important role to play, the missionaries have an important role to play. If we can take up these issues and bring a social movement to improve the healthcare. And health is something that we cannot delegate to somebody. We cannot delegate to the doctor. Health is also, you also have to take care of your own health. You also have a responsibility. So I think this is something that we need to really bring a different kind of a shift in the healthcare. So I'm very glad that you are trying to focus on those areas. So I'm also happy that this initiative, again, our Honorable Chief Minister has been really very progressive when we say, when this proposal, yes, when actually 56% of the Meghalaya health insurance scheme, MHS, is actually where people are taking health care from the missionary hospitals and the private hospitals. So that means, so there is a need to strengthen those hospitals too, because people are going there anyway. So this was the logic, behind when this was proposed, and the state cabinet has approved this idea of actually, strengthening the health infrastructure in the private missionary and private hospitals, so that what happens is that would in turn benefit the entire population.